We always hear about our DNA being the blueprint for our health. But what if I told you that's only half the story? We spend so much time focused on genetics, but the world all around you, the air you breathe, the neighborhood you live in, is constantly, and I mean constantly, rewriting your body's story. Okay, let's dive into this. We're going to start with one of the biggest health challenges on the entire planet: cardiovascular disease. For decades, we've known it's a massive problem, but it turns out there's a huge piece of the puzzle we've been missing. Just look at this number for a second. About 1/3 of all deaths globally are caused by cardiovascular disease. That is an absolutely staggering toll. And even with decades of research, those numbers aren't dropping as fast as we'd like, which, it begs the question. What are we missing? Now, this is what's so fascinating. We have poured billions of dollars into understanding the genetic risks for heart disease. And yet, all of that science tells us that our genes account for less than half of the risk. So where does the other 50+% come from? That giant question mark is exactly what we're here to talk about. Well, the answer seems to lie in this powerful and kind of new concept in medicine. It's called the exposome, and it might just be the key to unlocking the rest of that mystery. So what is it exactly? The exposome is basically the sum total of everything you're exposed to in your life that isn't your genes. It's the cumulative measure of all those outside influences and how your body responds to them from the day you're born right up until this moment. I absolutely love this analogy because it makes it so clear. Think about it. Your DNA, your genome, that's the blueprint. It's pretty much fixed. But the exposome, that's the entire history of the house, the storms it's weathered, the renovations, the pollution from a nearby factory, how well it's been taken care of. All of that is what determines the real condition of the house, not just the original plans. So now that we have a handle on what the exposome is, let's peel back the layers and really break down what's inside this lifelong log. This diagram illustrates the two main parts perfectly. First, on the right, you have the internal exposome. This is your body's own internal environment, things like your metabolism, your levels of inflammation, your gut microbiome. Then, over on the left, you have the external exposome. This is, well, everything else. Your diet, chemical exposures, the environment you live in, all of it. And let's zoom in on a really critical piece of that external world, what's called the social exposome. This isn't just about pollution or chemicals. It's about the very fabric of our lives. We're talking about things like your social connections, your access to good health care and education, your financial stability, and the safety and resources in your neighborhood. These are incredibly powerful drivers of health. Okay, so this is the crucial point. How do these external factors actually get under our skin and change our biology? Right? How does living in a certain neighborhood actually translate into a risk for a heart attack? Let's take a look. Let's go back to our main diagram, but this time, follow the arrows. See how they move from the external factors on the left to the internal biological responses on the right? You can see how exposures from the outside world trigger real, measurable changes inside your body. They can cause things like chronic inflammation, oxidative stress, a constant flood of stress hormones, and these are the very mechanisms that we know drive heart disease. Let's make this even more concrete. If you experience social isolation, your body can produce chronic, damaging levels of stress hormones. Living in a neighborhood where you don't feel safe can lead to a state of sustained low-grade inflammation. And the constant worry from economic instability, that can literally impair how your cells function. This is how your social world becomes your biology. It's not magic, it's mechanics. So understanding this connection is one thing, but acting on it, that's the next frontier. And this research proposes a new way forward. A whole new map for practicing medicine that actually takes the full picture into account. Here's the game plan. If you look at the left side, you see two streams of data coming in, a patient's personal health records and all this public environmental data. Then in the middle, all of that gets unified and analyzed using powerful tools like AI to find hidden patterns. This whole process leads to the outcomes on the right, a much better understanding of disease risk and, ultimately, more effective, targeted ways to keep people healthy. So this process builds a clear path to a better future, and it happens in 3 key steps. First, you unify all the data. Second, you use that combined knowledge to identify not just high-risk individuals, but entire high-risk communities. And third, and this is the real game changer, you develop interventions that are truly personalized. Not a one-size-fits-all approach, but policies and treatments that address the root environmental causes of disease. And we should definitely give credit where it's due. This innovative framework, the one that bridges the gap between our environment and our health, comes from the dedicated research team at the University of California, Davis. For anyone who wants to explore this fascinating topic even further, here is the full citation for the paper this explainer is based on. It is a fantastic deep dive into the science of the exposome. And that leaves us with a really powerful idea. The next time you think about your health, don't just think about your family tree or your diet. Look out your window. Ask yourself, what is my world telling my body? What factors in your daily environment are shaping your health right now?